Today we are going to talk about precision. When we talk about precision means, we all know about regenerative medicine. The word itself is telling you you have to regenerate, okay? Otherwise you will degenerate. So instead of being degenerated as we age, we better regenerate. If regenerate means we have to regenerate our organs, tissue, and our cells. Anyway, before we go that, this is my background. I'm past 60 this year now, and I've been in the field since 1985, spanning more than 3 decades in Europe with all the labs, all the productions, learning from many masters, right from Paul Nihan's partner, Frank Smith and Albert Landsberger of Heidelberg University, to many other different masters across the world, in Germany and even in Mexico. So I sincerely think I'm just sharing you whatever experience I learned. I started everything with human stem cells in the Soviet Unions in the 80s in the Institute of Biological Medicine when we are doing human stem cells from the human fetuses with my masters. And of course, in the other parts of Europe, it was in Germany, Austria, and Switzerland. We are so engaged with cell therapy, organotherapy with sheep, and in the later development, we have some new inventions. We went through a lot of new things and we change, we innovate, and we found out there were some very special animals, and they are SPF animals to ensure they are safe for use because they're safe from pathogens and bacteria, So throughout the experience of being a researcher and development, we own a lot of IPs, okay? Be it from stem cells to peptides to supplements to infusion. We do have compounding in Europe. We do have a pharma biomanufacturing plant in Europe under GMP for the last 30 over years. We do have drugs produced in Europe, which are not introduced to Asia, but they've been selling the last 30 over years in Germany. We do have a lot of things. It's just that we cannot bring a lot of things right to Asia because we are controlled by Ministry of Health of different countries. So we have to understand some of the products are not allowed in Asia, okay, or in USA. And then some other products may be allowed, but things are getting more liberal these days, even with biologicals. The world is opening up. With COVID, a lot of FDAs are changing to a certain extent, allowing to a certain extent, just like the COVID vaccine. Even in stage 3, they approve it for use, for emergency use. So again, with the stem cells in Japan, the government has been very liberal. They're opening up a lot of things here. So we come to realize all our products now are allowed legally to be sold to all the doctors on orders, and the doctors are allowed to prescribe to their patients by a form of individualized therapy. That opens a door to us in Japan, being one of the top countries in stem cell research, and all the injectables, all the supplements on our side are freely allowed into Japan in a way. And that is good. And the same with the Chinese side. We are working with the Chinese government. We have signed a contract with the Chinese government to provide education in biological and regenerative medicine. We have signed a contract with the Chinese government to set up a center for regenerative medicine, and at the same time to do labs and some form of manufacturing under research. That include the stem cells and peptides. So again, I would say the world is opening up. We set up a lab in USA. We are moving into FDA filings of INDs involving xenos products of microorganisms coming from Europe, which are approved in Europe in the first place, together with our nanopeptides. So these are the level we are moving in. I always say life is always changing every day. And I will always use a phone which is having the latest features. So in other words, you have to use a phone, whether it's Huawei or Samsung or iPhone. It must be the latest because you have more features. Same in technology, same in biotech, and same in regenerative medicine. It's the same here. Okay. Now we are going to talk about precision here. The word itself, precision, means you have to be very precise. Okay. The same things go for regenerative medicine. It's not just to regenerate the organs and tissue and using anything you want to do here. As far as I'm concerned, if I have to throw 10 darts into the dartboard, you know very well the bullseye is 50 points. The rest around the dartboard could be 1 point or 2 points to 20 points. Okay, but sometimes you don't even hit the dartboard, so you will probably have 0 point. So if you have 10 darts and you're going to throw every one of them hitting 50 points, you will have 500 points at one go. Okay, so that is what I believe in. I'm not going to use a rifle and shoot all over the place. I would rather use a shotgun and shoot straight and everyone hit bullseye. So I always believe that we must do this, and that's what I call my kind of precision medicine in regenerative medicine. It must be very specific. A will be always for a B will be for a B, a C will be for a C. And I'm not going to use an A and cover all kinds of diseases because it's impossible for A to be covering every kind of disorder or diseases. So if I have to treat someone with a liver problem, I will always say you must have the hepatocyte. Someone with a cardio problem, you must have the cardiomyocyte. Someone with Alzheimer's, you probably need the frontal lobe, okay, and not just the whole brain, because the whole brain has 67 different types of stem cells and cells. So this is, to me, is kind of the way our site has been working all along, the European Wellness Way, with our 26 clinics across the world for the last many, many decades. Our hospital has been around for more than 60 years now. So you can imagine that it is as old as me, you know. That means, although I'm one of the owners, the major owner of the hospital, but it has been around all the time, practicing regenerative, integrative, and biological medicine in Germany with a hospital license. And the same goes for Switzerland. We have it in Lugano, and the same goes for Switzerland in Greece. It's been there all along. It's not just in Asia. We brought the whole technology of Europe right to Asia, and now we are moving into America too. Now, the principle is that we go with the principle of similars. That means similia similibus curanto. Okay, that means like treats like. Exactly like what I say, A for A, B for B, C for C. And this principle has been on since a Swiss physician by the name of Paracelsus in the 15th century, and also with Dr. Samuel Hahnemann in the 18th century when he introduced homeopathy. It's the same principle involved. But this principle with the Orientals was also there for many centuries ago. Cell therapy or organotherapy has been practiced by the Chinese for more than 3,500 years ago, or it is even found in the Ebel papyrus, you know, the medical journals of the Egyptians 4,000 years ago. So it wasn't something new. Certain parts of the world have been going on with the laws of similars. And this is what I always say, you need the precision here. Now, we all know that the human body as a system, you know, has 12 different systems. Okay, and what is inside this system? Every system will have the organs and tissue. Okay, it doesn't matter any of the 12 systems. But what is all inside the organs and tissues? Obviously, it is the cells. And of course, among the cells, you have the super cells. You call them the father or mother cells or the parent cells. These are called the super cells, and they are called the stem cells. So there is stem cell all over your body, all over your organ in the first place. You're born with the cells and the stem cells. It's just that as you age, they go lower. Okay, I will explain that in the next few slides. So these are the 12 systems you have in your body, and you need all of them to work very well because they will have a domino effect in one affecting the other. So you have to make sure all the organs in the system are working well. Now, again, if you were to look carefully at the system here, they have different organs and different in different system. So one thing will tell you very well, everyone has to work well. I always say if one is not working well, you have a domino effect, which is very true. Okay, when you talk about a fatty liver, it's not just a fatty liver, or diabetic patient, it's not just a diabetic patient with the pancreas. He will have liver problem, he will have other problem too. Okay, and the end game of diabetic patient is always a kidney transplant. So you see that it goes around with the rest of the other organs. So again, I always say that your body system will start to go downhill when you start to age. And the problem is you're aging at a very fast speed. Look at your picture 10 years before. You're so different, and every patient who come to us will say, oh, do you know that when I was in my 20s, I'm very thin. Most of us are. Okay, when they're in our 50, we have a different shape, we have a different condition. Because your organs are aging so fast. Look at your lungs in the chart. You're aging, you start to age at 20. The brain starts to age at 20 when the frontal lobe of the brain is only fully developed by the age of 25 to 26. Your skin starts to age in the mid-20s. Your muscles you're losing at 30. Your hair starts to age at 30 and you start to lose hair. Fertility of a woman, or even with a man, they start to drop at 35. So that also explains why women in the later 40s have difficulty getting children. Okay, but of course there's a solution for everything. I always say there's a solution for everything. If you go with the right solution, it will go well. Now that means to say, now please understand, in other words, we are trying to say there's a timeline for aging. Okay, so this is a chart we did for you. And I did say the brain starts to age at 20, but by the age of 70, a lot of functions are not doing very well. You lose your muscle at 30, but by the age of 40, you realize your legs are getting thinner. Okay, and the males are dropping their hormones, testosterone is going down, so obviously the muscles on the leg will move to the tummy. There's no more muscle, but again, they have more fats now. It's the other way around. Okay, what about the woman? Again, the woman will be the same. They're double the fat cells of men. Of the male, so obviously they will also slim down very fast. They will not slim down, they will put on weight more. They have more fats in the body. Okay, you have to burn and your metabolic rate has gone down. Because after 40, 1 to 2% will happen with the drop in your hormones. And that's explain the reason for menopause and andropause to come into. Okay, so it's not just the organs of the cell aging. The organs are aging due to the cells and the stem cells, but your hormones are also dropping. Now, look at this. Your skin starts to decline by 1% per year from 20 onwards. So you can never expect a 55-year-old or 60-year-old will have a skin of a 25-year-old or a 35. Impossible. Okay, again, the skin aging of every one of us depends on how you take care of your skin and your environment and your lifestyle. Lungs at 20 and 70, you can see the aging part of it. And this is for the normal lungs. What about the guy who is smoking all the time? So you don't expect to have the best lung as you age. That means your stamina is coming down. Your stamina depends on your lung, your heart. So if you don't have good heart and lungs, obviously you have a drop in your stamina. So again, with your kidney, you know that you're born with fixed kidney cells. You have the best kidney cells when you're born. Okay, but as you age, the deterioration of the kidney will come in because the cells will not replace. It's a fixed kidney cells. They die off, they are gone. So we have to take very good care of our kidney in that sense. If you're pushing your liver and the liver will push the function to the kidney, so your kidney will go off. Okay, again, hypertensive patients, diabetic patients, because of their drugs intake, after a certain time, the kidney will go off. That means the tissue in the kidney will die off. So we have to repair the dying tissues left in the kidney. If you don't repair the dying tissue left in the kidney, they become dead tissues. There is no repair for the kidney. So this is something we have to understand very well and it's important. Now, the same with the heart. The heart is quite similar to the kidney. It's not very regenerative. That means you don't regenerate very well. Okay, and look at the heart of a 20-year-old and a 60 years old. Very different. Now, if you have a stronger picture, we have another picture, in our presentation, during the plaques presentation. The heart of a 70-year-old is performing only half the function of a 30-year-old. So that means to say you only have half the heart of a 30-year-old function. So obviously, again, you have to take care, because cardio problem is one of the biggest problem in the world in most of the country. Okay, so you have to take care of your heart. Now, brain, the most important organ you can ever think of, is shrinking. A lot of our organs are shrinking as you age. So when you shrink, means the functionality of them are going down. So that explains the situation why after 60 you go at a very fast speed of aging. If you don't have good brain, you will never have quality life, because the brain controls all the movement, all the senses. Okay, so the brain controls the whole body. So I obviously think that the brain is so important. You must have good brain. It is so important. Okay, especially with dementia and Alzheimer's. There's no way you can avoid that. Okay, but you can prevent that, because all of us will reach a certain stage where we have memory loss. Okay, where we have dysfunction and many dysfunction. Because after 40, at the same time, apart from losing 1 to 2% of your hormones, you will also lose 10,000 neurons from your brain every day. Every day you're losing, can you imagine? So do you expect you in 40 and you in 80 have a better memory at 80? Of course not. But the brain, like your body, need exercise. So if someone were to tell me, I'm going to retire after 60, I want to retire totally, I tell you, the brain will also retire. Okay, then you will age much faster and you will die faster too. So I sincerely think it is so important that your brain must exercise exactly like your body, like what you have to exercise for your heart too. So you must do certain function even after you retire. So in other words, our parents or our grandmother, they have to do a certain work. My mom is 90 years old. She cook for the whole family. She do the marketing for the whole family. When she cooks, she don't want the maid. She will be inside the wet kitchen and cook everything out, and then she will not do the washing. And I intentionally make her do that because she likes to do that. So you have to make her do that so that she has some form of activity every day and maintain the vast loss of neurons from the brain. The functionality of all the brain cells must be working, the different parts. Now, the same with the eye. We have a lot of aesthetic doctors, a lot of Korean aesthetic doctors, which I have because of my association with aesthetic doctors. Many of them after 50 were coming to me for eye regeneration because macular degeneration comes in. Okay, and you have to understand you're aging at 40 with your eyesight. Okay, so you will age. Everyone will age. So the only way is we can delay the aging, or we can prevent the faster onstart of the aging of the eye. So we did create something for the eye. You have to give the retina, you probably have to give the optic nerve, you probably even have to give the occipital lobe. So when we create an eye formula, it contains 3 ingredients here. Because there's no point for the eye to see and the brain cannot relay the message, because the message was not sent from the occipital lobe to the brain and from the brain to analyze and relay back the message to the eye. So all these are important. Okay, so you need the 3 things here. The good part is that we have managed to make them into a nanomite size of 2 to 3 nanometers. They can be served as an eye drop and drop into the eye. Because we are also treating a lot of animals, especially dogs with eye problem too. As you age, it's not only the human, the dog has the same problem, okay? Even with cats. So we did the same. It has to be with the eye drop, but of course, you will still have the IM. You can inject IM. With animals, you can do by sub-Q. Okay, you don't need IM for animals. You can also do by sub-Q. subcutaneous, because animal has thick skin, you can pull up the skin and inject. So the eye is one of the popular organs which we are selling very well to a lot of people, the older generations. Now, again, with the muscles, you're losing 3 to 5% muscle loss per decade after 30. It's frightening, You're losing muscle, So a lot of times we have to imagine our aging parents. Some of them even go for hip replacement, okay? Because they probably are losing too much muscles. So you have to understand we must have the muscles all the time. You must keep the peripheral muscles. What about the sportsmen? They need the muscles. You want to be good in sports, you want to be excelling very well, you need the stamina, and you must also have the muscles. You will have to have the good brain for fast connectivity. That means good brain for reflexes. Okay, so muscles is important too. So we do have something by peripheral muscles for the muscles. Of course, you have 3 types of muscle. You have the skeletal muscles too, and we do have another formulation for skeletal muscles for patients who need it, or even for smooth muscles, Now, the gut is your second brain. It is your immune system too. So you must take very good care of your gut, comprising the fauna, and the flora. So that means they have the good bacteria and also the bad bacteria. Of course, there are other formulation for this. But again, what would be the best thing for the gut? If someone were to ask me, what would be the best supplement for the gut? I would say you have to give a gut for a gut. That would be the best supplement. Okay, you can do that. Because with today's technology, we can acquire and procure all the 400 over different types of cells in the body. 400 over types of cells and not 1 or 2. Now, bone is important. You are losing bone after 35, and our parents, they are losing bone, and it's risky for us. After 40, we have to be careful with our bone too. We are not like as agile as before, because you're losing muscles, we're losing the cartilage, we're losing the bone. So all this has to be taken into account. Okay, can you have better bones? Mass? Of course you can. Apart from the exercise, you can have the bone. You can have the MO of the bone, the stem cells of the bone, the NOP of the bone, or the extract of the bone. There's so many ways to go with the organs. Well, what about the ear? We have some patients who is having tinnitus, some disturbing situation on their ears, and they can't concentrate very well. There are something we can do. You give the auditory system, and this is what we will go for everyone with hearing problem, and most of us will have it too, with a hearing problem. Fertility is one of the major problems you have. We have been treating a lot of people, ladies in the mid-40s, especially from China, who even come to Malaysia or go to Germany or go to Switzerland or even to our Greece center, and they have been treated for fertility. Ladies started the career, they go very high up, and by the time they have a good career, they may be in their early 40s, and that is a time where they want to have a family and they want to have the children, and the fertility has dropped tremendously. So we work and we have a contract with a hospital, one of the top IVF hospital in China. And the Professor Trump, who contacted me in Hunan, being one of the top IVF specialists, he came to me and told me, despite the IVF, there are also a lot of failures. Okay, so he was looking to us for some better solution. So we gave him some other solutions. The fastest way solution, where you probably can do that even before the IVF. Okay, and all you have to do to increase the fertility of a female will be to give the pituitary gland, which is controlling the hormonal system, send a message down to the adrenal cortex of the female, which is controlling the female hormones and the mood. Okay, further send a message down to the gonads, that will be the ovary, for the female hormones to be released, and have the liver too. That means you need the 4 ingredients here: the pituitary, the liver, the adrenals, and the ovary. Why do you need the liver? Because you need the liver to metabolize the release of the hormones. So it's for this reason you need 4 of them. So our endocrinologist, Dr. Margarita, and together with a US team of ours, and we are starting a research in China on fertility. Okay, we're moving to some studies, clinical studies on fertility in China. Okay, and that also includes the male. It's not just the female, because we have also been treating a lot of patients, male patients, even patients with azoospermia. That means they don't have sperms. Even a young married man could be married, and because of azoospermia, you don't have sperm. So we have to stimulate the release of the sperm. So again, with the male fertility, we have to go by giving the same thing, the pituitary, the adrena of the male, okay, the placenta, we can add the placenta there, here, together with the female, we can do that too. Okay, we have to give the liver, we have to give the testis. The male will always have the sperm, but the quality of the sperm go down by 35. So they don't have good sperm, so it's difficult to be a father. So if you increase the mortality of the sperm, okay, then the sperm, we have more sperms and the quality is better, then he can be a better, he will have a better chance to be a father. So we move it 2 ways on this. Now, again, we have been doing a lot for dogs. There's a lot of champion dogs and there's a lot of breeders who are working on this. We've been working very well with a lot of breeders from American hospitals together with the vets and the breeders who breed champion dogs. So most of this time, our experience, the last 2 years in USA with the American doctors almost every night, some of the good news we have recently was that the heat of an aging female dog now, instead of 1 year, can be even 6 months. And she can breed 2 times instead of 1 time. So this is big news in a way. And imagine for endangered species of animals. So the good part about us is we treat all the animals, all kinds of animals, according to the dosage on their weight. They are given according to the weight of the animals. So when someone tells me, what about the horses? Now the horses is so big compared to a human. Obviously, you have to give 7 times the dosage of a man. So it will be costing more to treat a horse. And for a dog, a normal big dog will be the same size of a man with the same weight. So then the dosage will be a man. Now, male reproductive organ, I mentioned ED problem is a big problem because it's also a circulation and artery problem. Okay, so you have to have a clear artery, you have a good circulation. Apart from giving the testes, you probably have to give the rest of the other thing to ensure he has good male function. But the problem with the drugs, of diabetic drugs and hypertensive drugs to a certain extent, will create ED problems when it comes to their 50s and 60s. It's common to have a lot of males having ED problem. Okay, so that is always a way to go with that. We can use with the Plex formulation which we have, and together with the testis, it'll be good for that. And the artery. Same for the female, okay, we will have the same thing. We can increase the hormones. We have to increase the female hormones. We can delay menopause to a certain extent. Because when menopause starts, means you start to age very fast. Okay, if you can delay menopause, why not? That means you delay aging too. If you have an early menopause, you're aging faster. We have a situation where there was one CEO in Hong Kong. She was only 29 and she had menopause. Okay, so there are situations like this. So another question is, someone was asking, can I kind of have back my menopause? We also have an experience of a lady in her early 50s, she managed back to have a menopause after losing it for a few months. And she wasn't the first one we did. We did actually have a few of them who had back her menopause by giving the pituitary, the ovary, the placenta, female, and the adrenals together with the ovary. Okay. Now, the brain itself, bear in mind with the brain, like I say, is the most important organs out of the 220 organs you have in your body. Okay. But the brain itself is 67 cell type. There's so many of them. Okay, so when we want to talk about treating the brain, okay, let's say you have a Parkinson patient, you have an Alzheimer's patient, and you have a dementia patient, or you have an autistic child, okay, you have a cerebral palsy child, what are you going to give? Are you going to give the whole brain? Or you are going to give a specific part of the brain where you can see from the MRI or from your observation as a pediatric doctor for a child, certain function, because every part of the brain have a different function. So the same goes for the cell. So we can give different brain cells to treat brain disorder. That is what I would say, that is precision. We are not just giving you the brain, we also give you the brain plus the specific increased dosage on certain parts of the brain. This is important. Okay, the pancreas. This is another interesting chapter, slide here. We know we have so many diabetic patients. 1 out of 4 in Malaysia is a diabetic patient after 40, or maybe the rate can even be more because a number of them don't even know they are diabetic. Okay, so Malaysian food are quite so attractive. Okay, same for Asian food, but it's not just Malaysia. Even for the Chinese in China, many of them are diabetic. I would say 8 out of 10 are having fatty liver too. So what do you go for the diabetic patient? Apart from giving the whole pancreas, we will give an increased extra dose of the islets of the Langerhans. What do you have in the islets of the Langerhans? From this chart on your right below, these are the 5 type of cells in the islets of the Langerhans. We have to give all these 5 types of cells. That means you give the islets of the Langerhans. It works better. This is precise. This is precision. So if someone were to tell you that guy is a diabetic patient, can I give a placenta, or can I give mesenchymal cells, or can I give some other thing, Let me tell you, the right thing to give will be the islets of the Langerhans. That would be the best thing. If you cannot give the islets of the Langerhans, you have to give the pancreas. Okay, you can give the placenta, you can give the mesenchyme. Most of the time, they're doing some stimulation. They are not going to do any homing. The specific repair will not be done. That is important, you have to understand. Now, again, for the digestive system, wow, again, 75 cell types, just like, hey, this is a liver. Again, with the liver, you have to understand with the liver, what is more important for the liver? The liver is a filter. We all know that. Sometimes it passes the function to the kidney when it's overloaded. But the liver is also a dustbin, When you take anything, it goes to the liver have to do the function. The more function you have to spend on the liver have a lifespan too. The lifespan of a liver is 70 years old. That means after 70 years old, the function will drop tremendously. So if I can extend the liver function to 80, because the liver is regenerative, you cut half of the liver, it will still regenerate. Okay, so that is a good part of the liver. It's the most regenerative organs of all your organs in your body. But if I have to treat liver at a very fast speed, liver cancer, you can even have a lifespan of 6 months maybe, So you have to understand, the best part will give the hepatocyte. That will be the best cells in the liver. And you must give the hepatocyte. So if we were to do that our style, we will give the hepatocyte of the stem cells, but we will also give the oral NOP, the nano-organopeptides or the microorganelles, to maintain where it contains only the whole liver. Okay, so when you give the whole liver, means some of the things are not used by the liver, because even mesenchymal cells is found in liver. So you can imagine how many cells are found in the liver.